Hi, Mike Matthews, physical therapist here with the PT411. Thanks for joining me. Make sure you hit the like button. If you're on Facebook, make sure you're following the page. If you're not already there, head on over to YouTube, like us there. Make sure you hit the subscribe button as well so you can be notified when I come out with future videos. So today we're going to be looking at the knee joint. We're going to look at what it takes to maintain a healthy knee. We need to look at stability and mobility. As far as stability goes, there are three things for the knee joint, well really three things for any joint for that matter, that provides that stability there. We have the shape of the joints, we have the ligaments that hold it together, and we have the muscle control. Now with the knee joint, it's a very flat joint. Yes, the joint is a little more concave on one side, a little bit more convex on the other side, so it does come together a little bit, but it doesn't provide the same stability as say the shoulder or the hip joint, where it's a nice ball and socket joint where it's nice and deep and holds it nice and stable in there. It's relatively flat compared to that, so we don't get a lot of stability from that. The other thing we get stability from is our ligaments. We have some really big, really strong ligaments that hold up most of the time. But if we rely too heavily on these ligaments and overstress them, they can tear. That's where you see all these athletic injuries with ACL, MCL, LCL, and to a lesser extent PCL tears. We have 4 big ligaments in there. But there's not a lot that we can do to affect these ligaments in a positive direction directly. We have to work on them indirectly. Same thing as the shape of our joint. There's nothing that we can actually do for that. The third thing, muscle control, muscle strength. And that is the only thing that we can directly address. We can address how we recruit those muscles, how efficiently we recruit them, how we use them when we're trying to balance ourselves, and strength, how strong we can get these muscles. So there's only a few muscles that we typically think about when we think about the knee, the muscles that control the knee. We have our quad muscle up in the front. When that muscle contracts, it straightens out the knee here. And we have our hamstring muscle in the back here. When that muscle contracts, it bends the knee. We also have your gastrocnemius. That's the biggest muscle in your calf area. It also crosses the knee joint. So whenever that contracts back here, not only does it point your toes down into this dorsiflexion here, it flexes the knee back as well. So we only have this single plane of movement right here. All it does is bend and straighten. There's not a lot of joints in the body that only do this. Several other joints in the body actually have greater degrees of freedom, including that hip. It can bend, it can straighten, it can abduct and adduct, it can rotate out and in, and it can do any combination of these in any other position here. So really that knee joint is kind of one of the only dumb joints in your body, and that's all it does. So you're not going to get much of any stability from your quad, your hamstrings, or your calf muscle. Yes, we definitely need to strengthen them, but you're not going to get much stability at all from these 3 muscles. It's actually what happens at the hip joint, and to a lesser extent what happens down at the ankle joint, that's going to keep it nice and stable. It's going to prevent it from going too far out or in or rotating in either direction, which ends up putting a lot of stress on those ligaments that we were talking about here earlier. So these muscles in the hip up here are going to prevent us from getting into those positions that are going to damage those ligaments down in that knee. So we have 3 movements in that hip that tend to be weak that contribute to instability at that knee. We have hip flexion, hip abduction, and hip extension. I have 3 videos that I've already gone over these with. So make sure you head on over to YouTube and you check out those 3 videos. We definitely have to keep those nice and strong. But for this video, we're going to be talking about mobility. We're going to talk about flexibility with the knee. I can't tell you how many people I've gotten into the clinic with their primary diagnosis from their physician being osteoarthritis or arthritis, and when they show up, they have anywhere from a small to a pretty big deficit in trying to straighten out their knee. It's not a strength thing that they can't control their muscles to straighten out their knee. It's a flexibility thing. It's either restricted or it's obstructed, and by the time we preserve that mobility in that knee, most if not all of their pain ends up getting resolved, and all we do is get back their extension range of motion. All we do is allow them to straighten out that knee all the way. And the first thing that we have to do is test this out. We need to compare our affected side to our non-affected side. That makes it much easier to take a look at it and see what's different. See if that straightening is different from the other side. If the non-affected side, you can straighten it out all the way, and that affected side, you can't straighten it out all the way. That's a pretty good indicator that we got to get that straightening back, and more than likely it's going to give us at least some relief of our pain. What can make pointing out this deficit a little more challenging is if we have pain in both knees, or if we only have pain in one knee but we have stiffness in both knees. So let's go ahead and get on the ground. We're going to take a look here, and you're going to prop your legs up on something. Get a pull noodle, a foam roll, anything that you can get underneath your ankles here. And the reason that we're doing this is to make sure we're not blocking any motion underneath those knees. We want to get these knees to that absolute end range of motion here. So with these propped up here, you're going to try to mash those knees down, straighten them out as much as you can. You don't want to push down with your entire leg. You want to push down with just those knees without adding any pressure underneath your ankles here. So if I'm pressing down, and let's say it's my right knee that's hurting me, and I'm pressing down and my right knee is not going near as far as that left side, it's definitely a deficit with this that I need to start working on. Or if I'm trying to straighten it out and neither is straightening out, there can definitely be a problem there. But the big thing to be careful with here is I'm sitting up, so I could very well be tightening my hamstrings, preventing me. So if you feel like you can't straighten out either knee, or if they look pretty symmetrical, go ahead and lay back and try to do the same thing here. Mash them down. See if there's a difference there from your affected to your unaffected side, or if both are hurting you, see if you can even just get them straight. Now, some of the other limitations here, some people completely straight is very normal. Some people's knees naturally will not straighten out to begin with, and some people's knees will hyperextend. They'll actually go further than this, and that's actually normal for them. So don't think that hyperextension in and of itself is a problem. It's very normal. I would say about half the people that I see actually hyperextend. So if one side is straightening and the other side is hyperextending, it's definitely the side that's only straightening that you have the deficit on. More than likely, it's not the side that's hyperextending, which can be very, very normal, and about half the population actually hyperextend. It is not an issue. It is not a pathology. It's completely normal. But this isn't an issue that happens overnight. Yeah, eventually we're going to start feeling pain. You're always going to go from no pain to at least a little bit of pain. Sometimes something happens that throws something off in the knee just enough after all that time of having that lack of mobility that all of a sudden the knee says, I've had enough, and it starts having pain there. But it's something that happens over time to develop this stiffness here. What happens throughout the day? Most of our day as we get older, we sit more and more. As we sit, our knees stay in a bent position. Just like any other structure in the body, when something doesn't move, it tightens. Our body is in a constant state of repair. So as that new tissue forms in there, it's going to form in this position. It's going to form in a tightened position. So before you know it, your straightened position goes from here to here. Now when this happens, our joint becomes very inefficient. It's not closing down all the way in both directions, and as that happens, it can create asymmetries within the joint. It can overwork certain muscles, and it can throw off the entire mechanics of this joint, this ankle, your hip, and your lower back. So we need to get that motion back if it's limited, and if we have full motion right now, we need to maintain that full mobility. And guess what? We're already in a good position here. If I was relaxing the whole time over the last couple minutes while I've been rambling on, that would have been our first exercise. All you have to do is prop your legs up on something, nothing underneath those knees, and you just hang out here. You can hang out sitting up like this as long as your hamstrings aren't that tight. You can do it laying down in bed as well. You can do it while watching TV. You can do it while reading a book. And if we get used to this pretty quickly and it's not quite doing the job, we can get an ankle weight and place it over the knee a little bit above that kneecap. You don't want it directly on that kneecap to push down. Get that weight, put it above the kneecap there. You want to use about 5 to 10 pounds there. If you don't have an ankle weight, you can get a backpack or a duffel bag, and you get the straps on either side of the knee joint there. Put a little bit of weight in there, prop up the ankle, and let gravity do its work there as well. Obviously, you're not going to be able to do it in this position. You're going to have to sit in a chair, on your couch, prop your feet up on the coffee table or another chair if you don't have one. We can also actively work on this while we have the weight on our leg. We can actively try to straighten that knee out in this position, working on this as well, pushing down, holding for a few seconds at a time, and relaxing, doing about a set of 10 to 15 each time we work on this. But we're not doing all of our sitting at home. A lot of times we're doing most of our sitting at work. Then we're not at an opportune time to lay on the ground on our bed. We're not in the place where we can actually prop up our feet and work on this. So we got to do this some other way. We got to take breaks throughout the day, make sure we straighten these knees out and keep them moving, keep them stretched out into extension, and prevent this from being a problem in the first place. So we're going to get up here on our feet. You're going to put your affected side, the side that you're going to work on, in front right here. You're going to put it in front of that other side. Your hands are going to be just a little bit above your kneecap right here, and you're going to be pushing straight back and try to straighten out that knee as much as you can. If you're having discomfort with this, just slowly flirt with that. Slowly try to work into it. See if it slowly loosens up over time. You're doing about a set of 10 at a time, and you're doing this all throughout the day, especially if you have a job where you're sitting most of the day. And oftentimes working straight into extension isn't quite enough. Most people that respond to this don't respond fully to just this, so we actually have to add a little bit of rotation into it. So with this joint, not only does it bend and straighten, there's a little bit of rotation that occurs naturally as we bend and straighten. As we straighten it out, it actually rotates out a little bit at this tibia. So sometimes we actually have to work into that rotation a little bit more. So you're going to start off the same way. I'm going to do it from this angle here. You're pushing straight back again, but once you get to here, you're actually turning your body towards that back foot over here. So if I'm turning my body inward, that would be the same thing as turning my foot outwards. So you have to maintain that pressure right there as you rotate away. I'm not just pushing down and trying to twist here. My entire body here turns. I'll show you from another angle right here. So as I'm pushing back here, I maintain that, my entire body turns. You don't want to start this one until you feel like you have full extension here. If you've gotten good relief with this one, but not full relief, you feel like your motion is the same on both sides, sometimes you need to add in this little bit of external or outward rotation to the end of that. Same thing, about 10 to 15 at a time, and you want to work on this one throughout the day. So that's the big secret, or rather the big piece of information that nobody knows that everybody should know. We got to keep those knees straight. We got to work on that mobility constantly, because over time, if we don't work on it, if we don't utilize that full mobility, we will lose it, and it will lead to a whole bunch of problems that are easily avoided if we start now. If we start investing in these knees now, we start treating them right, we keep them nice and mobile, especially with this straightening, I guarantee you, you will be at a much lower risk of developing knee issues in the future. And for those of you who are looking at a possible total knee replacement surgery, give this a try at first. Give it several weeks. If you start to see even a little bit of improvement, keep at it. People have knee pains, they see their physician, they get x-rays and or an MRI ordered, and the first thing that shows up is arthritis, so they get labeled with this diagnosis and they tend to lose hope. They know there's nothing that can be done with it, short of surgery as far as the arthritis goes, and to be honest with you, there's nothing that therapy can do to directly fix that arthritis. But there are so many people that have never had a knee problem in their life that are probably 40 or 50 plus, never had a knee problem ever in their life. You could do an MRI of them right now and they would show just as bad arthritis as somebody at their age that does have knee problems. Most of the time, arthritis is not a pain generator. It's often other things that can be easily addressed by physical therapy and exercise. But don't get me wrong, there's a definite need, there's a definite place for total knee replacement surgeries. But there are so many people looking down that road as the only option they have to pain relief, but there's a much easier, safer, less invasive road that you can go down to find that relief that you're looking for. So I definitely encourage you to work on this, no matter what your age is, your activity level is, or what you think the shape of your knees are in. Work on this. Give it several weeks if you have pain. If you don't have pain, go ahead and start working on this. And like I said, invest in the future of your knee health. Again, I'm Mike Matthews with the Physical Therapy 411. Thanks for joining me.